I'm here with Ann Becker, who is the new Harvard Medical School Dean for Clinical and Academic Affairs. She started on April 1st, and it's nothing like starting in the midst of a global crisis to have a trial by fire. It can't be easy, but thankfully Ann has been a longstanding member of the Harvard Medical School community, the Harvard University community, for that matter. Ann, can you just tell us a little bit about your bio?
Yeah, sure. Thank you so much, George. So as you know, I have been at HMS for a long time. I started as a student in the fall of 1983. So I guess it's been nearly 4 decades that I've been here, and I did an MD PhD as one of the first students in the social sciences MD PhD program, and then went on to do my psychiatry residency at MGH, and then a fellowship there, and then I joined the faculty in what was then the Department of Social Medicine and now the Department of Global Health and Social Medicine. But I've continued to maintain my clinical appointment at MGH, and I continue to see patients there as well.
Terrific. Well, listen, I think your preparation, both as a psychiatrist and anthropologist, are in many ways very, very fitting preparation for your role as the senior academic dean at Harvard Medical School. Can you just talk a little bit about your priorities in the new position?
Absolutely, yeah. And of course, by definition, my priorities are your priorities and the school's priorities. But speaking more specifically in our office, let me start by saying there's nothing like a pandemic to bring priorities into very, very sharp focus. And as you know, this office, Clinical and Academic Affairs, has a pretty broad scope, a broad umbrella of other offices it works very closely with. And these are, of course, all about ensuring the foundation of academic excellence in our community. And the offices are Office for Faculty Affairs, Office for Academic and Research Integrity, and Office for Diversity, Inclusion, and Community Partnership. So we work closely together with the respective deans of those offices, and also work with our affiliates to ensure that there is strong connectivity across the community. And, we talked for a moment about my nearly 40 years at HMS. And so I've been around long enough to know that this is a vastly complex ecosystem, and it's also very fluid and dynamic. And so I will say that I'm in full listening mode still, and will continue to be in that mode so I can work to understand what the needs are of our affiliates and our faculty, and in particular, what is unique maybe about our office, not unique, but what is a priority of our office is to be sort of the connector across the institutions and be sure that when collaboration is important, which of course it is, essential to our mission, that we work to facilitate that. So we are not only overseeing important critical processes for the school, such as compliance and integrity, but we're also, we hope, working with our affiliates and faculty to find and develop platforms where they can collaborate. So these things, of course, support innovation and research excellence.
And I think it's important to point out that the promotions and faculty development processes continue. And even in the setting of lots of other challenges and competing priorities, we are keeping a very keen eye to make sure that our faculty are celebrated for their remarkable contributions through the promotions process. So thank you on that. I know that you also brought together some of the leaders of our mental health community, and obviously that's very important to you, and we appreciate there's tremendous stress for our frontline clinicians and trainees and staff all across the community. Can you talk a little bit about what you learned and how you're background and your role really contribute to a deeper understanding of that.
Yeah, absolutely. And let me just also underscore that important point you made, which is that our priorities in the office, our immediate priorities have been twofold. First is to maintain the operations, which are so vital to our academic community, and that does mean appointments, promotions, reviews, etc. And also, of course, being sensitive to the kinds of accommodation or evolving needs that are emerging as we all grapple with the COVID-19 response. But with regard to the latter and your question, one of the concerns we had as the pandemic response reached very quickly, as we all know, a crisis response, and as there started to be a conversation about the surge in Boston possibly overwhelming the available resources in Boston, we started to hear as we, as part of the national conversation, what a toll this was taking on, in particular, frontline providers. And of course, in our remit are the clinical faculty, the well-being and support for clinical faculty at HMS. And so, we don't have a lot of empirical data to go by in terms of understanding what the most effective way to respond will be. There are some data from China around the impacts on clinical faculty as they have faced the COVID-19 epidemic there. In addition to that, we can learn from experience from former pandemics such as the SARS response. So we know enough to know that this kind of intense exposure to new situations, difficult decision-making can impose a real toll on our clinical faculty. And so we thought it was really important to start a conversation across the HMS community to find out from our leaders in the mental health field what it was that they were doing and give them an opportunity to share the information about what is effective, what are the best practices that they are implementing at their respective institutions. And we did that by convening a Zoom meeting of the chairs of the 7 departments of psychiatry across the HMS affiliates this past week. And we also on that call had others in the HMS community who are have expertise and a strong commitment to faculty mental health and well-being. And we started really just by sharing information. We asked the question to each of the chairs. We know they've done so much to curate informational resources, all kinds of innovative self-help resources, and to ramp up clinical services that can respond to the needs of their faculty if necessary. But we wanted to know what was working well and what they thought we could do better, what we could maybe do as a community, and also how we could look ahead to anticipate what some of the challenges will be, not just in the crisis phase of COVID-19, but also in its aftermath. This, I think, was an opportunity to think about this as, in the words of my colleague Paul Farmer, as an acute on chronic stressor, and to think about, this is not just a one-time event. We're going to, unfortunately, be seeing disruptions over the near term, and we don't know, maybe the longer term as well. And one of the really helpful pieces of this conversation was in hearing from Kathy Rexroad, who's the vice chair of the Faculty Council, around sort of picking up the important work Faculty Council has been doing addressing faculty burnout. And of course, there's also a national conversation about faculty burnout in academic medicine, and the school has been attuned to that, as have been the affiliate hospitals. But we see now an opportunity perhaps to re-engage with these important issues to support our faculty.
And thank you. I think it's really clear that we are one community we are sharing in the stresses and the burdens. And we would be better served by having folks who are feeling the stress to come forward and to seek help from their peers. The websites of each of the institutions, including Harvard Medical School and the Harvard University Health Service, have links to mental health support systems, and we encourage anyone who needs it to reach out. Melissa Bondrick in the Ombuds office is another confidential and very receptive sounding board for any of these issues. And thank you so much. It gives me a tremendous amount of comfort to know that someone with your deep knowledge of the institution and your tremendous loyalty to our community has stepped forward to serve. Thanks so much. And everyone, we will be using this forum, this video forum, on a weekly basis to speak to individuals in our community and to keep us all informed. So thank you very, very much. Until next week.